Easy smoke, easy go, that's just how you live. Oh, drag, drag, drag it deep, but you never give. Breathe it in, let it sit, while your lungs fade away. Had your highs, had your glow, now it's hard to blow. Give you every breath I had, tossed it in the ash, you tossed it in the ash, you did. To give your lives a chance was all I ever asked, but what you don't understand is through that smoke away for you. Let your lungs find their way for you. Take that pain, make it fade for you. You know I'd do anything for you. Black, black, black and blue. Lungs can take the fight. Oh, every breath's a little war in the dead of night. You said I'm strong, I'll survive. Now you're barely staying alive. You keep reaching for that flame, heart forgets your name. Your body is really strong, so strong that it keeps you alive for years through smoke and poison. But one day it just says that's enough. You climb just 3 stairs and you start coughing, your breath gone. That is COPD. Hi everybody, I'm Dr. Mirna's dentist, and today we're going to talk about COPD, the disease that makes breathing hard and smells less spready. COPD stands for chronic obstructive pulmonary disease. It's a long-term lung disease that makes it hard to breathe because the airways become narrow and damaged over time. What is the biggest and most important cause of COPD? In one word, smoking. About 85 to 90% of people with COPD are smokers or ex-smokers. The more you smoke in duration and number of cigarettes, the higher your chance of getting COPD. Interestingly, women may suffer more damage from the same amount of smoking compared to men. But it's not just smoking. Working in polluted environments, factories, living in smoggy cities, or even secondhand smoke can gradually destroy the lung. There is also a rarer cause, a genetic deficiency of alpha-1 antitrypsin. This protein is naturally made in your liver and protect your lungs. Without it, your lungs are like a wall without defense and get damaged easier. In short, 90% because of smoking and 10% because of genetics plus air pollution. Now you might ask what effects COPD has on the mouth and teeth. Several studies have shown that patients with COPD often have poorer gum health and surrounding tissues compared to healthy individuals. Why? Because most COPD patients have a long history of smoking. They usually suffer from gum inflammation and bone loss. Smoking reduces blood flow to the gums, making signs of inflammation like bleeding or redness less obvious, while tissue destruction underneath keeps going. That's why gum disease in smokers is often less symptomatic but more destructive. One of the most important things a COPD patient needs to be taught is that they should cut down on cigarettes and eventually quit smoking. If you're using inhaler medications, especially corticosteroid-containing ones for COPD, they may cause dry mouth or fungal infection like oral thrush. To prevent this, it's better to rinse your mouth with water after each spray. Many COPD patients breathe through their mouth at night because of breathlessness. This habit causes nighttime saliva drying and creates an environment ideal for bacteria. Result: morning bad breath, cracked lips, burning feeling on the tongue. To reduce this problem, use a humidifier in your room or a mouth moisturizing spray before sleep. So, COPD patients tend to have drier mouth because 1. Their medication decreases saliva, 2. Mouth breathing evaporates saliva, and 3. Smoking itself dries the mouth. This dryness increases the risk of tooth decay, mouth sores, and even persistent bad breath. Saliva plays a big role in cleaning the mouth and neutralizing acids. When it decreases, the mouth becomes more acidic and bacteria grow more. Because the body of COPD patients receive less oxygen, their wound healing is slower. So, if you want to extract a tooth or have oral surgery, you should allow more healing time and use antibiotics or antibacterial mouth rinse. Now it's time to say that easy smoke, easy go, that's just how you live. Oh, drag, drag, drag it deep, but you never give. Breathe it in, let it sit, while your lungs fade away. Had your highs, had your glow, now it's hard to blow. Give you every breath I had, tossed it in the ash, you tossed it in the ash, you did. To give your lives a chance was all I ever asked, but what you don't understand is through that smoke away for you. Let your lungs find their way for you. Take that pain, make it fade for you. You know I'd do anything for you. Black, black, black and blue. Lungs can take the fight. Oh, every breath's a little war in the dead of night. You said I'm strong, I'll survive. Now you're barely staying alive. You keep reaching for that flame. Heart forgets your name. For COPD patients, the dentist must check their respiratory status before starting treatment. It's better the patient be seated in semi-upright position so breathing is easier. And if the patient's blood oxygen is less than 90, which is measured with a pulse oximeter, dentist shouldn't do a long treatment session because it's a sign of unstable respiratory status. In that case, the treatment should be postponed or coordinated with the treating doctor. For COPD patients, the best time for dental treatment is usually morning when lung function is better. Also, avoid long treatments on cold or polluted days since cold air or smoke can trigger breathlessness attacks. If the patient has a cold or respiratory infection, the dental treatment should be postponed. In short, go for short, calm, stress-free treatments. Using local anesthesia is okay, but dentists should avoid using general anesthesia or drugs that depress breathing. Also, the treatment environment must be well ventilated because any strong smell or tiny irritant may trigger coughing or breath shortness. Now, what should people with COPD do to protect their teeth? For these patients, oral hygiene is even more important than for healthy people. Brush gently with soft toothbrush, use dental floss, use alcohol-free mouthwash, drink plenty of water, reduce and ultimately stop smoking. Have dental checkups every 3 to 6 months. Final word. We must understand that oral health isn't just about appearance and smiling. It's about life because when your mouth is healthy, breathing is easier. And breathing means life.